you can go very many ways with this. So I think one of the big challenges is that we still haven't really figured out what the consensus is on how a geriatric assessment should be, which topics should be included, how they should be assessed. So what we're seeing is that there are a lot of different, each study uses a different geriatric assessment, and it makes it very difficult to compare it across the line. So I think a consensus would be is a big challenge. How to actually translate a geriatric assessment to a treatment decision. In the first suggestions, it was simplified to a go, slow go, no go. But it's not that simple, because for each treatment these choices will be different. So I think that's an important challenge. And I was just in the previous talk, and I heard again that geriatric assessments are time consuming. And I think that's probably the biggest challenge we have to overcome, because geriatric assessments are time consuming, but they're not necessarily expensive. And we don't feel very limited in asking for another PET-CT or a more complicated MRI, which are probably much more expensive than the actual geriatric assessment. So I think that's probably the biggest challenge, is that we need to accept that it takes some time, but it's worth it. We can spend 30,000 euros or dollars on chemotherapy, but we can't take 20 minutes to assess if a patient can tolerate the treatment. That doesn't make sense to me. I think it's that the oncologists or the surgeons don't have the time, so you'd need to train a nurse to do it, and you don't have the nurse. But we didn't have a PET-CT either some time ago, and now we do. If we all take a stand and say this is necessary, in the end it will be cost effective. It's been demonstrated to be cost effective. But if we just accept that it's time consuming and we don't have that time, so we don't do it, then it will never be implemented. Well, I think the SIOG has made it very clear that this is something that should be implemented, but it's on a local level. You need to discuss it with your insurance companies, if they want to cover it, if they're willing to cover it. If you can explain it to them, I think that's much more important to make it. If you take a stand as an oncologist to say, I'm not going to give this treatment until I know if this patient can tolerate it. Well, I think that the SIOG guidelines are a good starting point, because they're very clear on both the value and the need for geriatric assessments. And I think there's a lot of literature out there that actually demonstrates that it's worthwhile to do it. So I think we just need to unite in this. I think that's probably the most important advice, recommendation.